amplified. So you get that much more damage further inland and risk critical infrastructure as a result. You also have problems with water treatment. The land gets, the water table gets salinated, and as a result, you have to either treat it or import fresh water, and it becomes very expensive. We technologically have the solutions to this, but you can't do this for the entire eastern seaboard. Katrina was not necessarily related to climate change. The evidence is still out really in terms of how climate change will impact hurricanes. What it seems is that climate change will make the proportion of severe hurricanes higher. It may actually decrease the total number based on wind shear and other things. We don't, unfortunately, have enough of a historical record to compare projections with, so we're at some level just going to have to wait and find out what happens. But Katrina is an example of what can happen to us if we're unprepared for one of these major events. And it was the most costly natural disaster in U.S. history. We had really significant displacement, permanent displacement as a result of it. This image here is a little small for you to pick out, but this is a map from the New York Times of Katrina's diaspora. And about 300,000 people permanently relocated. A lot of them went to areas in the South, in Texas, Louisiana, Alabama, and Georgia. I remember when the National Disaster Medical System was activated several days after this event. So all these people were evacuated out, and then wherever they went, whether it was Columbus or Atlanta, Hartsfield, Washington, D.C., they were triaged at the airport by emergency physicians and EMS physicians. And then if they were unstable, they were transported to a facility where they could be treated. And so I was at a public hospital that day, Grady Memorial Hospital, and we had a group of people who had just landed, and most of them were sent directly to a shelter. They were stable. But we had one woman who, for me, will ever typify Katrina. She was a roughly 30-something African-American woman. She was obese. She was addicted to methadone. She had congestive heart failure, and she was schizophrenic. She also smoked 3 packs a day. And I know that this is probably difficult for most of you to relate to, but this is actually not atypical for some of the most vulnerable people in New Orleans. And she also had just had a baby. She'd had a baby in New Orleans before Katrina. Katrina hit, she went up and she stayed on the roof for 5 days. The baby died of exposure, and she was without all of her medication for that period of time. So she was floridly psychotic. She was in decompensated heart failure. She was not able to breathe very well. And she was in withdrawal from her narcotic addiction and her tobacco addiction. So of course, we saw her at Emory, and we stabilized her in the ED, and then we admitted her to the hospital. And she got better and left. And over several months, I kept seeing her back in the ER. And it seemed like she's continuing to have problems with her psychiatric medication and other things. And then I stopped seeing her. And my guess is that she has died. I mean, she clearly had a very significant burden of disease going into this event. But displacement causes all kinds of disruption for people who are vulnerable. And it can be displacement from a flood, it can be displacement from any number of events. Even the people who go back, it causes a lot of community paralysis. It's very damaging to a community long term to have these significant environmental impacts. And you can see it with the Exxon Valdez spill, you can see it with refugee movement in Africa, you can see it here in Katrina. Another impact, you're going to hear more about this later today, waterborne diseases. Now, there's a very strong association between extreme precipitation and outbreaks of waterborne disease here in the United States. We're not exactly sure why. It probably is called multifactorial. It's got several different causes. It has to do with sewage systems and maintenance and groundwater transport of viruses and bacteria and surface water contamination. Like I said, you'll hear more about it later today, but it's a very clear association. And we're worried because climate change will bring more extreme precipitation events and may bring more waterborne disease. We haven't done a lot of research on this, but there has been some research projecting impact in the Great Lakes region. And U.S. have had some really significant extreme precipitation events in the last few years that have impacted your watersheds and your water supply. I'm not aware of any health studies of the impacts on gastroenteritis, diarrheal disease as a result of this, but I would bet money that there were impacts, they just weren't documented through surveillance. And what Jonathan Patt's colleague in Wisconsin has done is taken projections of global circulation models and downscaled them to the Great Lakes region, and then projected out extreme precipitation. And this is an image of the watershed all around the Great Lakes region. About 40 million people get drinking water from this area. And if you combine out higher temperatures and more extreme precipitation, you have a recipe for significantly increased burden of gastrointestinal disease as a result of these extreme precipitation events. So if you look at the late 21st century, the 10 wettest days, some of them are going off the chart in terms of the total amount of precipitation in a given day. And what we expect as a result of this is an increase in what we call combined sewer overflow emissions. Basically, the sewer system gets overwhelmed, and so all the sewage gets pooled and then dumped into surface water supplies. So we're expecting maybe a 50 to 100% increase in those, and those lead to contamination of surface water supplies, and then it makes it more difficult to decontaminate for drinking water uses. So we'll hear more about this later, and I'm curious to learn more myself about the management strategies here in Ohio. I know we've been doing down in Atlanta, but I know you've also been doing some work on this here. So if you look, Dr. Patz's work looked at Milwaukee in particular. He looked at the 1993 cryptosporidium outbreak, which sickened over 400,000 people. And it was a combination, it was a failure of water treatment, and then also combined with an extreme precipitation event. And that's a common theme, that we see multi-system failures, and those cause significant health impacts here in the United States from environmental exposures. But what we're worried about is that we'll see more of these as a result of these extreme precipitation events here. Now, briefly, I want to go into some global health impacts, because at some level it will most likely be in a different order of magnitude from what we'll experience here. We've got a significant underlying burden of disease in these areas. You don't have much in the way of reserve at a household level, at a national level. And of course, there are constant burdens of conflict and marginalization of women, and some other issues around the way the global health activities are organized. How many of you have read Collapse? One. So I recommend it to you. It's a really long but very well researched and well written book by Jared Diamond, looking at civilizations over history and how they've dealt with environmental change and what has worked to make them resilient in the face of these changes, and what has resulted in their demise. And so he identifies several different themes that are important, and I think important for us as we move forward and we think about climate change. For us, it probably will not be an existential threat. For some parts of the world, climate change will represent an existential threat over the next 100 years to their civilization. So I think that eventually people will be writing about climate change just as he did about some of these other exposures. These maps are bubble diagrams, and they give you a sense of the proportion of a population in a given place that has whatever exposure we're talking about. So this is a bubble diagram of the world that looks at people who live on under $1 a day. I'm going to go quickly through these. I just want to leave you with a general impression of the distribution of suffering and resources in the world. This is where people live with over $200 a day.
Is it obesity?
Well, it is. We can talk about that too. Girls not sent to school. Places that are primarily affected by disasters. Places where people are killed by drought, flood, malaria, violence, and here we're holding our own, unfortunately. Death from war. Climate change is going to bring significant shocks to these regions of the world, and then it's going to bring increased sustained pressures. The shocks are going to be in the form of droughts and floods and associated disease that comes along with it, cholera outbreaks and other things. There are going to be a lot of secondary issues that have to do, again, with that security question. Major social disruption, major mass population movement of probably on the order of hundreds of millions of people that will have to be accommodated within national borders, or there'll be refugees, and then the international community will have to respond. And then exacerbations of some of these other chronic diseases that we're already dealing with. This map here is of Malawi, and it looks at suitability for malaria transmission going forward, just based on temperature and rainfall precipitation projections. Essentially, by 2100, the entire country is suitable for